The philosophy behind the design of the hospital was really to build something that suited the people of Kenya.
There were so many women and children that were victims of domestic violence, and they didn't really have anywhere to go. There was really a need to have a centralized location where women and children could come and be safe and get medical care.
We wanted to provide something that would provide more of a long-standing relationship with the community and with its constituents to create a very interesting, complex, yet clear facility that could provide much more than just basic health care.
The first challenge that we had to overcome was us wanting to inflict our views on what the hospital should be. But all along, Mrs. Jordan made it clear that we were partners with the people of East Africa. And she made it quite clear that this is for the people of Africa.
How we organized the site was providing the inpatient and outpatient facilities at the top of the hill. Marching down the hill, we would provide more of the inpatient rooms, and those would have the views looking out towards the valley. And then we would provide the research and learning component in its own separate courtyard at the lower end of the hill. And that was adjacent to the Gender Violence Recovery Center, one of the key components that the foundation was striving to provide for the women of Kenya. And then at the end of the hill, at the bottom of the hill, was the family village or family hostel. So if you were coming for a procedure or you were trying to get away from your abusive husband, you had a place to stay.
I first became involved in the wellness centre when, completely out of the blue, I received a phone call from Mrs. Jordan. At that time, there were two catastrophic fires, one in the centre of Nairobi and the other on the outskirts, and they requested our assistance. Arriving in the hospital, there were literally dozens of patients who had survived the fire. Unfortunately, our techniques were slightly hampered by a lack of electricity. I used a rubber glove, therefore, as a tourniquet, which we fastened around the top of the leg or the top of the arm, and then literally, with just a scalpel, cut all the dead skin off until we had all of it removed. We had to really improvise terribly to keep some of these patients alive.
They didn't need us to teach them how to be good doctors. They needed us to teach them how to allocate resources better, how to translate research from the bench to the bedside, how to be able to put research and knowledge into practical applications.
The Jordan Foundation has done a wonderful job at bringing constituents, doctors and nurses, and people that will ultimately take part in making this facility happen.
I have never seen a person who is so energetic and enthusiastic and charming as Mrs. Jordan.
And I think there are a lot of people out there that say, you could have started with a small little clinic. And we did go back and forth a couple times and say, you know, this is a really big facility. Are you sure you want to do such a big facility? And she was very clear on the sense of what she wanted to provide.
She is just an amazing woman. She doesn't take no for an answer. You know, she's able to negotiate. You don't even know you're negotiating. She's going to get to yes.
As a leader on the project and as a visionary on the project, I think she's been able to champion this unwavering idea, but yet allow for flexibility and allow for those with professional experience to adapt and input in the idea to make it something that is functional.
But I think more than anything, we need to make sure that we have the support and the buy-in from the local community there in Nairobi. If they don't believe in the hospital, then it won't be sustainable. If we can get that type of buy-in from the community, then I think it can really serve as a model for all of East Africa, for all of the continent of Africa.
I think having an up-to-date and modern facility in which we can provide continuous care will be revolutionary in this situation.